All right, now we're in business. I'm going to go ahead and formally call this meeting of the Dunn County Health and Human Services Board to order for Thursday, February 22nd. First item of business is to call the roll, and I believe, with the exception of Dr. Hall, that all of the members are present, and we'll update the minutes if she joins us later. All right, we have minutes from January 25th.
So move.
Move to approve. Is there a second on the minutes? Mr. Lamb seconds. Any additions or corrections to the minutes from January 25th? Additions or corrections? If not, all in favor of approving the January 25th minutes, say aye.
Aye.
Any opposed? All right, the minutes for January 25th are approved. Do we have any public comment for today? No public comment. All right. Then our next meeting date is the 28th of March. Maybe it will actually be spring by then instead of false spring. That a problem for anybody, that regular date? All right. Without objection from the committee, we do have Tracy Fisher with us today, and she has a long drive home. And without objection, I would like to move her presentation up to this very moment. Any objections? All right, Tracy, welcome, and thank you very much for being here.
Thank you. I'm just going to share my screen. I prepared a PowerPoint here to share with everyone. All right, so I'm here to share with the committee today some good news from the ADRC. So as it said, exciting stuff from Suite 160. The ADRC is located in Suite 160 of this building. So it's exciting to share. This past legislative cycle, ADRCs across the state were thrilled that some advocacy that we had been working on for really a probably 2-year period, ADRCs were successful in getting additional funding for base rates in the ADRC world. So very exciting. In November of 2023, we actually found out county by county what our change in allocation would be. It took BADR, which is the Bureau of Aging and Disability Resources, which is the state agency that oversees ADRCs, some time to figure out how they were going to divide up the funding that the state received. So in Dunn County, this was the first increase in base funding ADRCs have had in 25 years. So since their inception. So exciting news.
Yeah.
It was the amount we received statewide was much less than we asked for, but it was certainly good news to receive any funding. So in Dunn County, we received an additional $76,111 in annual base funding. So we were very excited. Myself and my team, and along with Paula, I did a lot of thinking about the best way to utilize this funding and the needs that we have in Dunn County. And I really settled on outreach. Outreach is one of the core services ADRCs are required to perform. So we're different than a lot of other Department of Human Service departments. You know, Paula jokingly said when ADRCs first came about and they talked about us doing outreach and having marketing funding, it was a shock to the system because typically DHS departments, that's not really part of the core services that they're providing, but outreach is a core service in ADRCs. And one of our county aging plan goals for this next 3-year cycle will be to renew our focus on community outreach and engagement. Why are we renewing this commitment? One of the old taglines that we used to use in the ADRC world was "Know us before you need us." That's kind of fallen along the wayside, but I still really like that tagline. Data shows that connection with ADRCs prior to a crisis point is one of the most effective ways to assist folks in making good decisions related to their health, future planning, and use of financial resources. Unfortunately, many times the first time people have heard of an ADRC or actually have connected with us are at a period, what we call a crisis point, when they're taking care of their mom. Their mom is in the hospital. She's going to be discharged tomorrow. A social worker at the hospital says, "Hey, have you heard of the ADRC? They might be able to help." And the person calls us saying, "Mom is being discharged tomorrow and we need all sorts of services, and can we get them in place?" And unfortunately, that's just not the way it works in our world. We have lots of resources, we have lots of options we can provide them, but they just don't work that quickly to get them in place. And so we realized the best way to connect with people or make sure that people understand what we have to offer is prior to a crisis point, when they can do some thinking, planning, they have some education, so that when they are in one of these positions, they already have the information they need. Um, Data across the state also shows that, really across the country, participating in what we call an evidence-based health program leads participants to feel more engaged and connected to their local ADRCs. So the evidence-based health program is kind of an ADRC term, but I always call it, these are kind of the fun programs that we're able to offer: exercise programs, educational programs. All of the programs that we provide are vetted through the state and are evidence-based, meaning that there's a system that we follow to show that they have positive health outcomes, but they're also meant to provide engagement opportunities, provide what I call an in. So when somebody meets us in one of those settings, when they're, participating in Walk with Ease or Strong Bodies or something like that, they get connected with the ADRC. They know somebody from the ADRC. They might have a question that they can ask that facilitator in a non-threatening setting, and they just start to learn about us in a setting that they feel more comfortable with. So my focus on outreach really is wanting to be able to engage people before they're in a crisis, make sure that we're getting the word out about the ADRCs. And another point of what I really want us to focus on is doing outreach in our rural areas of our county, instead of having such a strong focus on Menominee. Not that I want to discontinue things we're already doing in Menominee, and I want to grow the things we're doing in Menominee, but I really want to partner Colfax, Boyceville, Elk Mound. A lot of folks have wonderful community centers, areas that we can use at free or no cost. So trying to provide some of those resources to those areas too. Again, that has been challenging in the past. And so some of the strategies that I have to meet my goal of increasing our outreach and our connection are meant to deal with some of those challenges. So one, in order to increase outreach and engagement, I realized we simply need more capacity. So one of my approaches is to increase a part-time program assistant position to full-time. Currently, the woman who is in that position, we call her our caregiver coordinator. She does all of the caregiver support groups and runs our caregiver support program. She's currently a 24-hour-a-week part-time position, but we have moved that position to a full-time 40-hour-a-week position, and we're going to be calling her an outreach coordinator. So she will have added duties, including doing some of these evidence-based health practice programs. She's going to have a focus on offering programs in rural areas, connecting with the other areas that we can connect with and have free space to utilize to do some of these programs. Also, she will serve as a backup for our nutrition program. I'm sure many of you are familiar with our nutrition program, commonly called Meals on Wheels, or our site-based senior dining centers. Bernie Allen is currently our nutrition coordinator. We definitely need a backup for him. That's one of our largest programs, and right now he runs that pretty much completely on his own. So great to have backup. Bernie is as reliable as they come. He rarely misses work, but we never know, somebody could get I always like to say somebody could win the lottery. I don't like to say somebody's going to get into a car accident. I like to say they'll win the lottery and they're going to leave us, but everybody should have a backup. So that's part of that goal, is that she'll be the backup person for that position. And I did include costs. So the cost for increasing Casey's position to full-time, including her benefits, is expected to be $46,500. But again, this cost is fully funded by our
Sure.
additional base funding. The second goal that I have is the sustainability and development of the outreach engagement increase. So my second plan is to actually change the role of Bernie, our nutrition program coordinator. I'm actually proposing that we change his position to the aging/transportation program coordinator. So he will oversee all of our Older Americans Act funding and our 8521 transportation grant funding. So Older Americans Act includes the nutrition program. It includes those evidence-based health practice programs and our caregiver program. And then our 8521 transportation is the grant funding that we receive specifically for transportation programming for adults with disabilities and elders in our community. This change in position, I think, will be vital in innovation and directing the outreach plan. Having somebody kind of oversee those, have it as part of his working goal to provide some of the direction and the supervision of the programs will be very helpful to me. And again, he will actually kind of train as a backup for me as the ADRC manager. I have a 2-year plan kind of figured out for the development of these roles. And eventually the goal will be that Casey, the outreach coordinator, will actually take over completely some of the roles that Bernie currently has as the nutrition coordinator, because obviously he's going to need space to develop some of these other plans. And the cost to move that position from a grade 1 step 11, which is where Bernie is at right now, to a grade N step 3, which is where I propose that that position be moved to, is $8,632. Bernie already is a full-time employee and he already does have benefits. So and again, this cost will also be fully funded by the increase in base funding that we received. Again, one of the overall goals is to provide services to rural areas to increase outreach and engagement. So again, we want to increase the availability of evidence-based health programs in rural areas, which will be primarily one of the goals of Casey in her new role, and then development of transportation program to rural sites. That will be something that Bernie will be developing as a goal of his. I would really like to see a program where some of our 8521, like perhaps we could provide maybe starting out a monthly route provided by our transit company for people to come into town and shop, that sort of thing, do doctor's appointments. And then depending on how that's utilized, we could potentially even work to increase that to more than once a month to different rural areas. I definitely see that as a need that will probably take some significant development and working with our transit department to figure out effective ways for that to happen. But that's definitely one of my goals. And I think that it's really necessary and fair for the rural areas of the county to have some access to those services. And there's no direct costs associated with this goal. It's just one of the things that we'll be working on. One thing that I just wanted to point out is that this funding that we received, this additional base level of funding, I mean, obviously it has to be spent on ADRC related programming. We can't just take it and put it into the general fund. And Bader, the Bureau of Aging and Disability Resources, they've actually pinpointed November as a date that we I, as an ADRC director, have to provide a report by our November all-state meeting where we're talking about how they say the new and innovative uses of this new base funding. So there is some urgency for me at least to move this along so that I have something to report on. But obviously every county is working on these sorts of plans and going in lots of different directions. Some counties may be using this to fund a completely new position in one of their areas. Again, I feel like at the moment in the ADRC, our needs are being well met programmatically on all the programs that I don't feel like we need another position to serve one program or the other. That's why I really feel like this is the time where I can develop that outreach and doing some of the programming to really make sure that folks are able to access ADRC services and have the opportunity to learn about us in new and exciting ways. So my ask of this committee is just that you would support our goals and strategies and our request to change the nutrition program coordinator to the aging and transportation program coordinator in both grade and title. Any questions or comments, suggestions for me?
I'd like to hear comments from the committee. Supervisor Hagan.
Thank you. I've been hearing just out in the public, people out in the rural areas really wanting services where they are. So I think developing this plan to get more services out into the wider county, I think that's what people are looking for. I think that's a perfect thing to shoot for.
Thank you.
Anyone else?
There's no questions. I had some follow-up to what Tracy
Okay.
was saying.
No, I would just say that I agree with Supervisor Hagan that I think the outreach to the rest of the county beyond Menominee is a very good and probably very necessary approach. And I will also add that we had a long and kind of lively report last night in county board from the area libraries. And there's a library in Sand Creek, there's a library in Boyceville, there's a library in Colfax. And I bet you that they would be really thrilled to be working with ADRC to sort of add that. They are looking to get more people into the libraries. They have, sometimes they don't have the best facilities, but they have adequate facilities. That kind of partnership might be extremely helpful for ADRC. And they're so fun.
And some of the programming that we can provide are not necessarily like, we don't need a gym, we need just
Right.
a space. So that's a wonderful suggestion.
Right.
Yeah.
Thank you for that.
All right, Ms. Winter, go ahead.
Right. I just wanted to follow up with some logistics of this
Okay.
piece. Tracy said that I could take that piece of this. So thank you for that, Tracy. Logistically, what happens with this, because the job description that Tracy was describing for Bernie's current position, the nutrition coordinator, is going to have a significant change to that. And when that type of thing happens, we have to then update the job description, and we also have to update something called the JDQ, which is the job description questionnaire that talks about like how much time is spent in each activity and all those things. Tracy has done a wonderful job. She had all that prepared, submitted it to HR when we met with them, and then talked about next steps of this. And so what we thought as a recommendation in HR, and Chris was there with that, is that we would bring it to this committee to talk about and to receive your support, hopefully, on that. And then at the same time, HR is submitting that to Carlson Detman for their review. And then they would come back hopefully with a recommendation that would say this is where it would be on the grade scale and all of those pieces, because there is not a title like this already in the county. So you have to do those things. And so we were hoping, because of kind of the pressing piece of this, as not only that Tracy needs to report back, of course, but we received the money. So we need to use the money in order to get it.
Yeah.
Right. So if we wait for 4 months, then we're not using the money and we won't be able to bring it in and can't bring the taxpayers these great programs, till later. So we may be leaving money sitting on the table for this year, and we don't want to do that. So the request is that we could then move this forward to the administrative or executive board. Would it be next, executive or
Doesn't it
administrative?
go to admin first?
Admin? The,
I think it goes to admin first.
to the JDQ and Carlson Detman's recommendation. Right.
Yeah.
So admin, that we could take this to admin next, and they would review whatever that recommendation is from Carlson Detman, that you would allow that or support.
Okay, and Hillary said she couldn't hear us.
Oh,
Don't we just, okay, we're back. That's what I hear. All right,
correct.
all right.
Yep.
So sense of the committee. Supervisor Steen, what do you think?
Yeah, I think it's a good idea, as I'm kind of a rural area guy. And be happy to, and I know our library, and I'll speak for all libraries, they would all be willing and and able participants to help you. Please utilize them if you can, because they're very people friendly, as we saw at
Mm,
our meeting. So I would be in favor of this, and if I can help you in any way, if you need larger meeting places, we can find out where you could be in Colfax, where you could be in Ridgeland. Ridgeland has a community center.
Yep.
If our village hall is too small, I could approach the Viking Bowl, which would be a good place to have it in Colfax. And I'm just saying that, and then the idea that you are trying to run a bus, from a rural area in, I hope that is successful. We tried before years ago and the ridership wasn't there. But I think that if, I'm just saying you had a Tuesday shopping trip from Ridgeland, and then a different day for Boyceville,
sure.
I think that would be well received. So it's a long way of saying I'm in favor of it.
Supervisor Hagan, do you have anything else to add?
Just on the outreach portion, when you brought up someone's mother being in the hospital and getting services for them, one thing that struck me were potential people out there who are unaware of the program, who may not have that family structure in place to reach out to the center for them, and just having the outreach program be there for people who may be on their own or not necessarily have a family structure supporting or surrounding them at the current moment. So I think, again, the outreach is good. And for the change of structure, that's nothing that we really have to do. But
No, it's
in
not our
that
job, but
sense, that's something that I don't see any issues with from my perspective either.
Supervisor Breslin, will you weigh in?
Basically, Andrew basically said everything that I was thinking, so I don't have any issues with this.
All right, Dr. Hall?
Yes, I enthusiastically support more outreach. I'm excited for this. It's great.
Ms. Rudy?
Very much support it. And I think reaching out to the rural communities, especially in the area that I'm in, looking at our adults with disabilities coming in from 17 to 18 years old. I know that a lot of our rural schools would like a lot more outreach on that and help educating our families. So very much in support.
And Mr. Lamb?
Yes, I also obviously very much support it. And just the idea of more outreach. Sometimes I will encounter people that I might say something about what ADRC does or can do. And a lot of people that have told me, I had no idea.
I know.
And then they said, I wish I'd have known that 6 months ago because my mother or my grandfather or, there was an issue of some sort. So yeah, I think it's great and excellent use of the additional funding that we'll have. So, yep.
Yeah, and I have absolute faith in the department staff and your leadership to do this the right way. It's not really our purview, but I'm sure that you will figure out how to make this work. Oh, I'm sorry. Thank you. Supervisor Robinson, I forgot to ask you to weigh in. Shame on me.
I think it's great. Everything that I was going to say has already been mentioned.
Well, good. It's good that we are thinking alike, and thank you for reminding me. I didn't mean to ignore you. I really,
Oh.
really didn't.
You're good. Thank you.
Okay. Do you have what you need?
We
Thank you
appreciate
very
your
much.
support.
Thanks, everyone, so much.
Thank you very much. All right, moving on to the next agenda item, which is Veterans Services. Greg is on active duty in Texas, I believe, but is joining us remotely.
Good evening, everyone. I appreciate the flexibility to be able to give my report.
No problem.
Here. I will start the report off with the memorandum document that identifies the local, state, federal, financial, and then the staffing of the office. We are continuing our planning with, we have, I'd say, good 6 to 7 veterans that are assisting with the outreach event that is scheduled for the end of April. We've received, or for the event, there's been some good donations, good raffle items, and again, that's the stuff that helps make the event even more special for those that attend. When we're talking about being able to provide food and some handouts, so that's really looking good and coming together. I had provided a short interview. The Eau Claire Leader Telegram had contacted me about a local veteran. I had included the article
Yeah.
in the packet for Mr. Herb White. I did receive his
That was so
permission.
nice.
Yeah, he's. I just have a high regard for him, and I expressed that in the interview that they had provided, and he also has been able to participate in the honor flight to get out. We're losing so many individuals with just incredible historical pieces and things that they've done, and so it was nice that was done. Just draws attention to things. So I was very honored to be able to at least make a comment. So that I think that went well. And also I'd met with workforce resource staff. There's an employment program that I was able to make one referral right away, and it's more along the lines that just that additional assistance that sometimes individuals that have some barriers to employment where they can get placed, and where it's not, I won't say a burden to the employer, but it's not a high investment other than time and location for a person to develop some good work skills. And so hoping that we'll be able to do that for some more. We have some individuals that definitely need to improve their, get some work experience, or even just to show a positive work history. On the state benefits side, two things: the supplemental CVSO grant report. I'd worked with CFO just to close out. We had received last year a supplemental grant with some leftover ARPA money from Governor Evers, and so we had spent that out last year, and basically we used that for some more for some salary, which reduced our overall salary burden, and then we move it into this year. So it was we'd worked together. So I got that report to close that all out, and then the CVSO grant. There's a small increase. We received $11,000, or did last year, for that grant. It was increased to $13,750. I actually submitted the grant trying to get $15,800 because the census data said we meet that threshold for population, but Wisconsin Department of Veterans Affairs uses the Department of Administration data. So we needed like 50 people. So I took the number that worked for me, sent it back and said, adjust the budget. So I did. And sent that back. Yeah, well, it's there wasn't clear guidance, so I just used census data. The next, the federal benefits, met with Representative Van Orden's office, and just thought they just more interested in kind of that just quick snippets on some of the challenges. I don't identify challenges without identifying things that are going well, because no organization is doing bad. We just happen to sometimes focus on the negative when there is incredible things that are going on everywhere. So I made sure that I really commended the community care program, which I think we'll see some challenges with some of the closure of health services going on in Eau Claire. We haven't seen it yet, but we're anticipating that because you're going to have less resources, and those were providers of the VA that helped our rural veterans. So I'll keep my ear to the ground on that, and I'm hoping that there'll be some resolution. We keep the same number of providers and services in our area because it will impact that demographic. The two areas, and I've spoke to the board regarding the CHAMP VA, which is a health insurance program for those dependents of veterans that are 100% disabled. And there's some significant challenges with that. Our state association is drafting a resolution to send to all of the legislation. They're well aware of it. They're working on getting answers on how they can improve their business practices. And I think it's more of it's just that balance of bringing on some AI in making determinations on stuff that has created some challenges, sending it down, maybe creating delays. So there's a lot of attention on fixing that. And then Board of Veterans Appeals. And it's not on this report, but there was an event on Sunday I had attended. There was a meeting with Van Orden's office, Representative Van Orden's office on Sunday. I thought I was going to be there just to help veterans sign up for some online applications to help with travel pay. They just asked for some assistance from some local service offices, but it was a meeting. But it's easy when you're working with veterans every day. You really know what some of those challenges are. It's really, we just talked about some of the same things, and there, of course, some of it was ended up in the news. So I'm hoping that it was all good, positive comments from that. So it went. I think it. Let me refresh.
We're back. We're back, Greg. Although Greg does not appear to be with us.
Yeah, could be.
I'm refreshed. Are you able to hear me? I can continue with my report.
Yes, we're good. We can't see you now, but we can hear you.
Okay, I'll turn the camera back on. At what part was the last information that you were able to receive from me?
I'm sorry, Greg.
I was just wondering where did I leave off? I suspect I talked a little
You
bit.
were just getting to financial.
Okay, all right. As we had talked prior to the meeting, and I'll just address it just for the particular meeting. There is a carry forward request that is in the packet. However, it's not an action item that will be brought forward at next month's meeting to be approved.
Like we may walk us through this because we may agree to move it forward, and then and once exec makes the decision, when bring it back next month. So
Okay.
walk us through it.
Okay. The request for the carry forward is donated funds. I broke the two line items down as far as donations: medical equipment donation of $1,315.49, and then veteran relief donation $7,544.27. There's a number of organizations that did a couple of fundraisers this last year that so this is quite a significant amount. We didn't spend all of it, so that is we're requesting to honor the intent of those funds. And that's what the request is for the carry forward. Met with our CFO to agree and help prepare the carry forward. Although I did not get that on the action item for the agenda, but that's the overall request, is just honor the nature of those funds carry forward.
You've
and then we
explained
can
it,
meet the
you've
intent.
explained it well. It's fine.
Okay, thank you. If there isn't any questions, I will talk briefly about the 2024 financials that I placed in the packet, which is limited. Again, we're for these purposes, we're a month into
Right.
the financials. I don't project any concerns going forward with the 2024 financials, and then we'll keep an eye on the carry forward or bring it forward next month. And I had also included for the group the 2023 final financials. There should not be any further adjustments, and that's I met with our CFO to make sure that everything was closed out appropriately. Pending any questions for me?
Any questions
well,
for Greg?
Actually,
Hearing
the
none.
one I forgot to discuss our veterans served report. There's just three impact statements on there that if you have any questions regarding them, I can further elaborate. But the significant thing with our veterans served report is we made the adjustment to take that cumulative total that was off in line or row number 13 that was misleading as far as those total pending claims. So we made that adjustment from our conversation last
Good.
month. So will just reflect open claims, which will adjust as they fall off, as they get closed out and we add new ones.
Any questions on that? No? Okay.
Thank you.
Well, because you asked. Yeah. All right. Go ahead, Greg.
That will conclude my report.
Okay.
If there's no further questions.
Any further questions for Greg? If not, thank you very much. We appreciate your taking this time to join us. Stay safe.
Yeah, thanks for the flexibility. Appreciate it.
Anytime. We appreciate your work. Okay. Moving forward to the Department of Public Health staff report. KT.
Deal. Excuse me. So a little late getting you guys my write-up, and so you had that emailed to you today, and then I have a couple copies in paper format if you wanted to do that. Take a peek at it. I will also share my screen and just bring that up so that you guys can have an idea of what that all looks like. All right. All right. So a couple things we wanted to highlight with our WIC funding at the end of the year. You will remember we received some unanticipated funding at the end of the year. We wanted to make sure we didn't leave that on the table. One of the things we did with that funding was to work with Highway to get a new sign that's visible from the street about how to get to WIC, which is fantastic.
And may I interrupt you for 1 second?
Yes.
I had 2 supervisors last evening say, well, what about WIC? What is this? So they had obviously seen
Yes.
the new sign.
Yes. And so hopefully that'll diminish the number of folks that we find kind of going in the main door and wandering around
Sure.
in circles. So especially when you've
Great.
got littles in tow, a couple extra steps can really make a difference. So we're super excited, grateful to Highway to have made that sign for us. And then also, I think a very effective way to end up to use those dollars in a way to get the word out. You also have an update on where we are with our water testing lab. So you're looking at a refrigerator and very lovely scientifically appropriate refrigerator, and we have a incubator that's on the way from Oshkosh, and we're moving quite along. I did want to help you guys remember that we are looking to transition out of TNCs or transient non-community water wells for Pepin County. They have hired on their own environmental health specialist. And in 2025, they will be taking that program back. Because we are doing those TNC site evaluations, so you see Amy there, and the DNR representative with their new environmental health specialist for Pepin, we're being really intentional about protecting the community and transferring that institutional knowledge to Pepin County. So I wanted to thank her for doing that work and also call that out for you guys. A lot of public health emergency preparedness. So you may have already heard from the 911 coordinator and emergency management that we had a tabletop exercise where we brought a lot of partners together and really looked at where our areas of opportunities are and build relationships so that you know who to call when, instead of holy buckets, the sky is falling, who do I call now? And so that was a really good use of time. And then I wanted to extend my gratitude to Dr. Hall and to others in the community. There was a last minute call to educate Elk Mound Village on the benefits of fluoridation to their water system. That was on their agenda on Wednesday. I was at a conference. And so there were a couple quick calls. Dr. Hall sent something out for the village board, as well as one of our local dentists. So that was really good to see.
Way to go.
Yeah, so thank you for that. Yes, but it is my job to educate. And so I think that's what I'll sum up our, I love that Canva post for Walk-in Wednesdays. It was really cute having our Walk-in Wednesday on Valentine's Day. We are continuing to see people for almost real-time results for STI testing. So we have some little, COVID just made things, you just expect to have answers quicker now. And so we have some grant funding that we use to purchase what's called VisBee. And they're basically cartridge looking things, and they run real-time PCR. And so it's a really nice, quick 30-minute test for folks with vaginas that can give you almost instantaneous, that feels like instantaneous results on STIs, which is nice. All right. So I also in your packet today have a the same kind of state provided laboratory surveillance report. What I wanted to point out is that we are likely going to see a double peak with influenza. Yuck. So if you haven't gotten your flu shot, please consider it. Talk to your provider. And if you are home, or if you're sick, especially with a fever, stay home until you are 24 to 48 hours fever free. So I wanted to bring that to your attention. And then short and sweet, any questions before I jump into finance?
Any questions for KT?
Yes, sir.
Supervisor Steen?
Is there an influenza B?
Yes, there is influenza B. You can see from the state that we are seeing influenza activity is high in Wisconsin. A is the dominant strain, but there is some influenza B circulating as well.
The reason I asked, my great grandson has it, so we're at it.
Oh, boogers.
Thank you.
Okay, finance?
Yes, finance. Yes, please.
Okay, so finance, much like what Greg had shared, we are just, for all practical intents and purposes, 1 month in. So you have numbers in front of them. They don't look abnormal, even though they don't tell you a whole bunch just yet. So you do have them. I also wanted to lift up that, like Greg, I am going to have to bring this carry forward request back to you for approval. It is,
We're going to try to
Sure.
finesse that a little bit later.
well, and to just be fair, I did want to share what you're looking at. You were looking
Yes.
at the, when we had a couple grants, and you can see this in the narrative, we had a couple grants that they extended their spend out date And so we had not budgeted for them in moving forward. And so we are including them as a carry forward. And we had talked about that previously, like with the public health vending machine. And that we have, again, ARPA dollars that we had budgeted for some of them, but did not use them in the same way
Right.
because of the reduction. And so we have more dollars to carry forward. And so those unanticipated extensions, as well as those multi-year grants, are what you're looking at in the carry forward, or what you would be looking at in the carry forward.
And the amounts?
Sure, 100, oh, there's a double dollar sign, look at that. $163,225, and they're
Okay.
broken out into a couple different grants, and you'll see that the largest one, the largest chunk being our public health ARPA and our COVID-related grants. But then we also have, again, a multi-year grant in reproductive health
Okay.
that was not budgeted for.
Okay. We can come back to this if people have any specific questions.
Okay.
Okay.
Thank you.
That
That's all I
it?
have.
Thank you. All right, moving on to the Department of Human Services, Ms. Winter or Ms. Albright?
It's my honor tonight to pass the torch on to Ms. Albright. What we are doing in the Department of Human Services is really looking at cross-training and having the ability to take vacations and things once in a while.
No.
And so Becky has volunteered tonight to do the director's report, and I volunteered to do the minutes. So here we are, handing it over.
Excellent.
But Miss Winter is the one who prepared the report. So thank you for that. I'm simply reading. So thank you for a gentle introduction. Well, Paula, Chris, and I had the fortunate experience today to attend a roundtable, I guess you would call it, meeting. And there were several other community members there. We had our chief of police, Stepping Stones, Arbor Place, Chamber of Commerce, Oakleaf, our superintendent of schools. I'm sure several other people that I'm missing, but it was a good mix of community members. And we talked about our closures of Sacred Heart Hospital and Prevea Health and what are we doing about it, and talked a lot about how Eau Claire has a task force that they have started.
Mhm.
So we are trying to follow suit and get ahead of things. So we are going to meet monthly, if not more, and hope to stay ahead of all of that news. So with that, some of the updates that we had provided last month regarding those closures, some of those points were for our Birth to 3 contract. We do have our OT and our PT contracted through Prevea at this moment, but of course that will be ending as of April 21st. So we have completed a fiscal analysis, which showed that it would be a cost savings for us to fill the PT and the OT positions within the county, so hiring them directly. So that would be versus using other providers and contracting through
Contracting.
them. Their prices were higher. We have met with HR and with our county manager to begin these discussions, and I submitted the job descriptions and the job description questionnaires. So we are well on our way.
Good.
And regarding how other counties are in that same exact boat, I would say we are very fortunate where we're at this exact moment. So fingers crossed. Regarding the updates for the youth and the adult inpatient mental health beds closing, we have collected some data that does show that our inpatient placements at HSHS last year for 2023, there were 8 individuals placed there. And for 2022, there were 9. And for 2021, there were 12. So regarding those increased costs of transportation that we will have to be incurring to travel to, say, Winnebago or Mendota, if we're using alternate transportation providers outside of law enforcement, that's going to have a cost of about $1,000 for one way. And we already saw that. That was 2 Fridays ago. That's already happened. So we're already seeing that.
regarding the update on consumers that we work with receiving medical and psychiatric mental health services who will need to find new resources to help address that new need that we now know of. We have moved the date of hiring the clinic clinician that we were going to hire in July to our current posting, which some of you have already seen. So very excited about being able to do that as the need has certainly presented itself. Regarding an increase in the social worker case management time that is being used to assist consumers in transitioning care as well as managing their crisis mental health issues. We do have our social workers working with consumers to ensure that their crisis plans are current and helping to identify and connect with some new providers. And another update from last month regarding the medical clearance wait time. Sacred Heart's ER in particular was a popular destination for our emergency detentions and medical clearance. So in their absence, the wait times at Mayo's emergency room ER will go up and most likely already has been experiencing that. And the volume of crisis responses involving smaller and rural ERs could go up as well.
Becky, may I interrupt on that point?
Yes.
Did I recall that Mayo announced that they were trying to expand their emergency capacity?
I'm assuming they are attempting, but it's not quick enough.
Dr.
Go
Hall.
ahead.
So there was a WEAU had some reporting out from that task force out of Eau
Mhm.
Claire, and Mayo has said that they are going to work to increase their emergency room capacity and urgent care capacity. But in terms of details on that,
Okay,
I
all
don't
right.
know.
At least they're acknowledging, so that's good news.
Yeah.
And hopefully working on
Yeah,
it.
sorry for the interruption.
No,
Thank you.
that's fine. And so we're working to evaluate the workflow of ERs through a work group that will create efficiency in the process for local ERs, and that is in process. Yeah.
Dr. Hall.
So one of the other things that I learned about kind of looking at those kind of news articles is I guess the legislature just this week passed a bill to approve a process and grant funding for crisis centers for mental health. And so I was wondering if either of you could kind of speak to that and fill us in on what's happening with that and what kind of a timeline we're looking at, because it's a new program.
Sure. My understanding is that the money that was designated to St. Joe's or HSHS for mental health services is now being reallocated through
Right.
that process for emergency services. So trying to be able to
Right.
help the emergency part of it versus the mental health piece of it. So it still has to be signed off by the governor, I believe, yet, right? Or, yeah, by the governor. Yeah.
So I was
Yep.
gonna say,
Yep.
it's bricks and mortar,
Right, right.
not service.
Which, certainly, I mean, that's something to help. My concern with that, it was meant for mental health services, and we were really looking forward to having something that would help with our crisis needs with mental health. And so that kind of takes that opportunity away. And I know there was other places that were interested in applying for that money to be able to do something with the crisis. And now
And that money
kind of-
was a long time coming. Senator Bernier engineered that, and it was entirely for mental health
Right.
capacity.
Right.
So
And so now we're looking at a broader scope, I think, with emergency medical needs. So it's not fully passed yet, but they're working on it.
yes, Supervisor Steen.
Yeah, thank you, Ms. Chairman. Last night, the representative of Representative or Senator James mentioned the funding. I want to make sure I got this right, but it was only confined to Chippewa and Eau Claire County, I think.
Yeah,
So, okay, just wanted to point
It
that
is.
out. Yeah, all right, thank you.
okay.
All right.
Go ahead, please.
Then moving on to our department activities, we do have a community program for individuals called Choices or FEP. And I believe you have heard Sarah Olinger talk about that in the past.
Mhm.
And that is for individuals with first experiences of voices, visions, and other signs of possible psychosis. And she is having a psychosis simulation and informational session that we are opening up to all of our friends here at the table. We would love to have you there, and it will be held on April 18th, right here in this building from 10 to 11, right here in this room. So if you are available and interested in being there, we would love to have you. Please let Ms. Winter know if you are able to attend no later than March 11th. She needs to know.
It
And
says
this,
it's
oh, that's true.
the date changed because I was gonna say it says Thursday, March 21st. Okay, all right, got it.
I just will have to post it if there's several of you that want to.
Okay. Okay.
Have an open meeting.
No,
Yeah,
right.
walking forum or whatever.
No,
Yeah.
we don't want that.
So please consider attending that. It should be amazing. And it will be right here, so you'll already know where you're going.
What time was that?
It is from 10 to 11. Then moving on to our fiscal news, we do have a change to the regulations involving the type of license which providers have, therapists or clinicians, in order to bill Medicare. So this change will allow us to bill for some of the clinic time that our clinicians are spending with persons who have Medicare or Medicare Advantage plans. We expect that this change will have a positive impact on the revenue of our clinic. So that is positive news.
Mhm.
And the positive news does not stop there. We have even more. So our state news from our Department of Children and Family is regarding kinship language. So our DCF administrator has shared that legislation that provides crucial support to Wisconsin's kinship caregivers has passed in both houses and is now headed to Governor Evers' desk to be signed into law. So previous law narrowly limited who could be considered a relative for the purpose of placement of a child. So those very narrow limitations impacted who a child could be placed with, as well as the financial support the caregiver could receive through the kinship care program. So adoption of this new legislation means that we have a lot more support from kinship caregivers and a respect for how families self-define. So some of the key points of this are that the legislation expands the definition of relative to now include first cousin once removed, and expands the definition of kinship care provider to include relatives like kin, and for tribal children, that means extended family members. So like kin means an individual who has a significant emotional relationship with a child or the child's family that is similar to a familial relationship. So this definition is a much bigger and broader scope now, so we can place with many more families, which is very positive news. Any questions on that piece? That
Any
was kind of a
questions, Rebecca?
mouthful. Okay. And we wanted to share something fun and positive that we did have a department chili cook-off, and I regret to inform you that my chili did not even come close. However,
No.
we did have two fabulously excited winners. Casey Polgorelski and Mary Lindberg were #1 and #2 for our chili. So if you'd like to join us next year, we may just invite you and have an additional chili cook-off. And
Great.
also, we did have a speaker come in December. His name was Jesse Horn, and he presented at our all-staff meeting, and he shared his life story of living with autism and how he grew up in Buffalo City, where he still resides. He's a fierce competitor in the field of sports stacking, which is cups. I don't
May
know if
I
you ever
ask,
seen
I mean,
it.
like the dumbest person, I have no idea what that is.
It's stacking cups really fast and taking them all down, like in 0.2 seconds.
I see.
It's amazing.
I see. Okay.
It's quite a skill. Yes.
Got it. Okay.
Yes. So
Well, who knew?
he's a national
I don't know.
competitor. I didn't know either. I know. And the very fun part about all of this is that we are now having our own March Madness, and we are going to do speed stacking within our DHS teams. So, and Paula and I even get to participate. Some of us are more excited than others.
And since we have video capacity in the government center, perhaps this could be filmed.
It will be here in this room. And yeah, and I may or
My tax dollars at work, absolutely.
speak for yourself. And I may or may not have shared that information with Jesse Horn. And he is thrilled to hear that he has influenced us. And it was just delightful to hear how his background and what he's done with his skills and what he's done now. And Paula knew him, so she brought in the great speaker, and that's all the fun stuff that we do during all staff meetings.
Great. I'm glad that you have fun every once in a while.
Yes, we sure do.
You need to.
Yes, yeah.
Then the next piece is our logo.
Oh, yeah. There we go.
That is our new logo. So you will see quite a few colors on the little person that is between the D and the H. And those colors are representing many different important pieces of our department, such as autism, mental health, dementia. And we had a vote throughout our entire team where there were several choices and they had to pick which one they liked the most. And this was the one that won. So we are going to use this hoping to use this on our letterhead and on possibly some clothing and different places that we can post. Because, you know, if WIT gets a cool new look on their sign.
New sign.
We would like to have a cool new sign too.
I can see sweatshirts, right?
Yep.
They all need sweatshirts.
Yes.
Yeah, definitely.
I like it.
Thank you.
Yeah, it's fun.
And then financial.
Finance, yeah, we need money.
Okay, let's start with the 2023 financials. It was in your packet. We have a draft because this still continues to be in draft form, probably another month or two for the 2023 financials. But right now we are at 499,994, almost $500,000 dollars that are to the good. So we are sitting there being able to hopefully give that amount back to the county
That's great.
for 2023. And then.
Good financial management.
Thank you. And then for 2024, 2024, we're only looking at January. Same thing KT and Greg said. So, 610, but that's just, that's without much information in there yet. So any questions on either one of those two reports?
Are there any questions? And Supervisor Breslin and Supervisor Robinson, I don't mean to ignore you. I just can't see you. Any questions for Ms. Winter?
No, I do not.
Nope,
Supervisor Breslin, any questions?
none at all. Thank you very much. Great report.
Good, thank you. All right, anything else from Human Services? All right, I'm going to kind of stumble on this, and the county manager is here if I stumble too badly. So you've already heard Veteran Services and Public Health have budget carry forwards. Greg and KT have both explained what that is. It is sort of the process of the county that all of those carry forwards as early as possible, so would be March, come together in a kind of omnibus presentation that goes first to the executive committee and then to the full county board. We didn't have those as an action item on today's agenda. But because we've talked about it, I would like to get a kind of sense of the committee, if you are okay with us sending that forward. It's all, I mean, the document is already done. And so if we could, with your permission, if we could then subsequently include in our minutes of our proceedings that we have allowed that to move forward, and we will bring it back to look at our March meeting. I mean, it will be essentially pro forma because it will already have been approved, but they're pretty self-explanatory. I mean, this is not new money. This is not so I guess I would like the sense of the committee if that's how we can proceed, and then Greg can be made good and the public health department can be made good, and we're good. Any concerns about that? Yes, please. Because I didn't do it right.
I was researching. No, you did it just fine. No, I was just
No.
gonna say that, so I was researching while I was sitting there and so you do have both options. You don't have to, okay, there's no requirement anywhere that it comes to you as a standing committee first.
Right.
It's practice and past
should be.
practice, but and yes, that's probably best practice, but it's not written anywhere. Secondly, it's not a statutory requirement or a rule of one of our ordinances. So it's the option that it can just go to exec and to county board. That being said, there's also not a requirement for a time frame. So if you are not comfortable with just sort of your endorsement of it at this point, and you want to have it come back for your March meeting, and we do another round of carry forwards in April, that's a possibility as well. The consequence to that is just that the money won't move into
Right.
the budget in the
Right.
financial system until the carry forward is passed.
Yeah, thank you for clarifying that. I think my tendency here is to say, these are pretty routine. Let's let it go, and it can come back if it needs to next month, just for information purposes, that we should send this forward. Mr. Lamb. Right, Mr. Lamb.
Yeah, I agree. I guess I would feel most comfortable if it's gonna be put in the minutes somehow that we were not taking any, it's not on the agenda. So we're not taking any
We're not
action.
taking action.
Don't, so it's not like it, yeah, just so it's reported
Exactly,
that way. Yeah.
exactly.
So I,
are
with
we-
that caveat, I'm fine
Okay.
too.
Supervisor Steen.
Yeah, along with what the member Lamb said there, I think we all agree to move forward with this, and I would suggest, and county chair or county manager can correct me if I'm wrong, bring it back at the next meeting as an action item then.
I mean, the decision will already have been made, so it's almost a moot point, but
You can retract it. I mean, the budget could be changed, it could be changed after the fact if you decide you don't want to do it in a month.
Well, I don't want to gum up the works, but I'm in favor of moving it forward. I just don't want to be challenged on it later because my understanding is that the whole board here is in agreement of doing that. So.
Supervisor Hagan.
Yeah, if there's no statutory requirements that we would run afoul of, I'm in favor of moving it forward to the next committee. Yeah.
Dr. Hall, did you?
I'm also in favor of moving it forward.
Okay. Ms. Rudy?
I'm also in favor of moving it
Yeah,
forward.
I thought that was the sense of the committee. Supervisor Robinson, Supervisor Breslin, will you weigh in, please?
I'm in favor of moving it forward as well.
Okay, thank you. Supervisor Breslin?
No issues here.
All right, the sense of the committee, that this can go forward. And if we want to put it on the agenda as an information item for next month, we can certainly do that. Okay, everybody's good with that? All right, moving forward, we have another sort of issue to deal with. For some reason, the vouchers, the DHS January vouchers did not appear in the budget. So I'm going to need a motion to table the review of the January vouchers until our next meeting, which is whatever it is. It's March 28th.
I so move.
I need a
Madam
second.
Chairman.
I'll second.
Supervisor Steen and Dr. Hall seconds. Any additional discussion on that? All right, all in favor, say aye.
Aye.
Any opposed? All right, so we'll take the vouchers up next month. So then we do have two action items to take up, and the first is the Human Service 2023 carry forward into 2024. That is in your packets. I need a motion. Supervisor Steen, Mr. Lamb seconds. Any discussion? All in favor, please signify by saying aye.
Aye.
Supervisor Breslin, the chair couldn't hear you.
Sorry, I was muted. Aye.
Thank you. Thank you. All of the resolution passes. And the second is the Health Department budget resolution, adjustment resolution in the amount of $2,000. Again, I need a motion to approve. Dr. Hall moves. Supervisor Hagan seconds. Any discussion? All right, all in favor of the public health budget adjustment, please signify by saying aye.
Aye.
Any, Supervisor Breslin?
Aye.
Oh, good, thank you. We all voted aye, no, great. So, this also passes. All right, so unless we have birthdays or special occasions or anything, we are almost adjourned. Supervisor Hagan.
Well, since you mentioned special occasions,
Yes.
this past February 4th, I got married.
Congratulations! Congratulations, that's quite wonderful.
No wonder you were absent. That sick business didn't fly.
He was lying. Well, maybe we'll have to have wedding cake.
I'll bring some next meeting.
All right, thank you. Anything else from anyone? Without objection, we are adjourned. Thank you, everyone.